Welcome to Boombostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Each week, we bring you candid conversations with top experts, innovators, and leaders, exploring the latest trends and technologies shaping the future of healthcare. Join us and be part of the conversation in transforming healthcare. Hey everyone, this is Bradley Bostic. Welcome back to another episode of Boombostic Health. We are on episode 25, and I've got joining me today some fantastic folks that are experts in the field of healthcare innovation and also happen to be key players on my team at HC1, Jeff Myers and Matt Martocci. Thanks for joining, guys.
Awesome to be here. Thanks.
Thank you, Bradley. Excited to be here today.
Absolutely. Awesome. So one of the areas that we hear a lot of questions about is what is going on with the strategies within major healthcare systems as it relates to the laboratory. And one of those areas of focus is on what they should do with their lab testing in terms of having offsite or core labs. We've seen some massive transactions that have occurred over the past several years related to major players like Ascension transacting their laboratory operation over to LabCorp and having to manage through all that, which, as an aside, the HC1 team had a lot to do with that transaction with our HC1 and Acumen folks, which is definitely something we're proud of, and also has given us a real inside scoop into a lot of the things that are most important to health system and health system labs. But before we get into that core topic, I got a couple of things I want to cover. First of all is I'm wearing a shirt that is very important these days. And you can't really tell that it's not an Iron Man shirt because that's what you would first probably guess where I'm positioned here. But I'm going to pop up here and show the quote, "What do you think you're doing, Dave?" So I offered the trivia question, and for everyone out there listening, just think about for a second, jot it down, make a mental note. What movie is this from? And Mr. Martocci right away nailed it because he's a movie aficionado. Matt, what movie is it?
Space Odyssey 2001, and I believe that is HAL.
HAL 9000. And in the movie, everybody who's interested in AI and technology has got to go out and watch that movie. It was incredibly prescient. And in the movie, I won't spoil it for you if you haven't seen it, but some things go wrong while there's this deep space mission underway. And the computer, which is this artificially intelligent computer called HAL 9000, is in charge of guiding this space trip into deep space. Really fascinating movie, and definitely speaks to some of the perils that can go wrong when you have some of these hallucinations and issues. So that's that. Now, in other news, I want to point out that Jeff Myers is a fan of a university that they talk funny there, and I've always been on the other side of getting beat by them with the teams I follow. Having gone to Indiana University, I don't think we could get into the stadium most of the time. But Jeff, what's your favorite team, and why?
Thanks, Bradley. I think people who know me know that I graduated from the University of Tennessee, was born and raised there. So definitely that Rocky Top, and taking a lot of grief from the college football playoff when we proclaimed that Ohio State would be kneeling north, and I think that lasted about 1 minute into the game. But definitely a proud Tennessee fan, and I'll just leave you with this. Being a sports fan is a lot of disappointment for just a few highs, right? And I think you could say that for anybody outside of Alabama football or Ohio State football. So good fun stuff, though.
Yeah, they even lose every once in a while. So Jeff also is one of the foremost experts on the economics of laboratories and on the financial performance and strategies to really maximize value and evaluate what to do with lab assets and health systems. So we'll get to that topic as well. So then also my friend Matt, he also has certain sports that teams that he's most excited about. And, I'll let him talk a little bit about that here before we get into the meat of the conversation.
Well, I mean, pain and suffering goes along with living in New England, right? So out throughout my childhood, we had the Red Sox and the Patriots as just constant losers, and then, the 2000s hit and they could do no wrong. So it was great. I mean, I remember watching the Super Bowl with my kids, and they're like, "Why aren't the Patriots in the Super Bowl?" They just assumed that every year they
Right.
would.
That's just normal. And why weren't they just kicking everybody's ass?
Yeah, yeah. So
So
now we're a little bit of downturn now. That's okay. We have UConn basketball, but yeah, a lot of sports tradition up here.
I was thinking probably UConn basketball would be what you would say, but I get that also you've got to follow those other big teams. So okay, let's move into the meat of this thing. Really, there have been a lot of changes in the health system lab industry. We see them firsthand every day, and also in the commercial lab industry. It's a constantly evolving space, and one that people don't realize this as much as they should, but there is no more important diagnostic information in terms of how comprehensive it is than lab information across the entire health journey. So when we start talking lab, if you're a health system person or a healthcare innovator, don't tune out. If you don't work in the lab, don't tune out. This is the absolute hidden gold or Rembrandt that's in the attic in many of these healthcare systems. But I'd love to hear, Jeff, just real briefly, the rise of offsite core labs in the 90s and 2000s. Why did all of a sudden all these offsite core labs start popping up?
Yeah, Bradley, that's a great question. And, if you go back in history just a little bit, LabCorp and Quest formed in 1990. And during that decade, you had several health systems that created these collaborations, what we would call joint ventures. And they were flush with cash and they had the ability to invest in offsite core facilities and drive significant volume. And as that decade went into the new millennium, you saw a lot of those joint ventures become monetized with some really high capital dollar amounts we're talking about. But as those joint ventures dissolved or unfolded, what happened in response to that is those core facilities did not have that volume. Okay. And as we've gone into 2010 and into this decade and into 2020, a lot of health systems are really being pressured with respect to bottom line margin. Post pandemic, about 4% operating margin is where your nonprofits are running. And if you convert that, we'll just use some easy math to easy free cash flow. Like how much cash do you have to invest in strategic initiatives? There's not a lot left over. And what's happening with offsite core laboratories at its core, no pun intended, you're duplicating services that are taking place at the hospital. And so what you're seeing is more and more hospitals redirect that testing back to their core hospital because there's not enough volume to drive what we call in lab that economies of scale.
So what
So
you're saying is that the health systems started to realize there was an opportunity, and that was in part because you had these major independent commercial players in LabCorp and Quest popping up, and so the health systems. When you said they would do joint ventures, you're saying they would do those joint ventures with these major health labs, or with whom?
yeah, no, great question. No, they would do this with other health systems or regional based lab players such as PAML,
Okay,
Dynacare is
so the
another
idea
example.
was let's generate more volume together in a core lab that we go on to get on together. And then at certain points, LabCorp and Quest would show up and make an acquisition of that external business. And that would generate a big economic event at the time. But then once that economic event was over, and so the JV was no longer there, then all of a sudden you had these hospital labs that were out there that didn't have as much volume as they could support, and you had sold this core lab, and so it was a time to direct more volume back to just the core, or I should say core to the hospital lab. Is that
That's
kind of how that
exactly
played out?
correct, Bradley. That's
Okay.
exactly correct. You need at least 5 million plus in test volume and about 25
To
million in
support a core
outreach
lab,
revenue.
to
Yes,
support
sir.
an
Yeah.
offsite core lab, 5
Yeah.
million.
5
Yes.
million tests in total to really support the cost of the facilities, right? I mean, you think about, let's just say, for example, a 70,000 square foot facility, that's 40 million bucks.
Right.
And as
Yeah.
constrained as hospitals are today, they're looking at innovative strategic initiatives. And typically that doesn't pass muster, right? That
Right.
doesn't
Yeah.
surpass the hurdle rate.
So like anything, there was this big boom, a cycle like this,
Mhm.
and then it hit to this certain point and it tailed off, it changed, it evolved. Now, Matt, you've been in the more of the commercial side of the lab world and also have become very adept at understanding this broader view that includes the health system. But how have some of these trends I'm hearing from Jeff related to what you've seen in more of the independent labs in terms of how they've evolved and grown and changed over time?
Yeah, I mean, we saw the advent of the reference lab. So, reference labs popped up all over the country, and they were handling the volume that Jeff speaks of, to what the limitations of the hospital lab couldn't provide. Right. So, hospital labs would enter into agreements with reference labs, and the reference labs would handle that volume or that test volume, like, for example, LCMS volume that the hospital labs either didn't want to do, didn't have the staff to do, or the time. And so they acted as a conduit for further testing. And then the results would be sent to the hospital lab, and the hospital lab would share those results with the providers. Hence, also, the reference labs would become labs for the providers in the area. So the physicians, nurse practitioners, anyone who wanted to run tests, they could also use those reference labs. So it became more of a competitive environment.
So when I look out into the future, it seems like, again, everything goes in cycles. It seems like there's this new cycle as I look forward that is emerging where you've got new players that are saying, we'd like to go bigger with our lab strategy. We think we can use this information, this asset better than what we have been. And maybe they evaluate again. Maybe what's old is new again, where health systems are evaluating, do they sell off the labs operations, their outreach, which is the component that's more externally facing versus the inpatient testing? But are we looking all of a sudden at this renaissance again, where you'll find that health systems are getting more aggressive and strategic, and also the reference labs are becoming a bit more redefined? I'm seeing emerging consolidators now as well that are kind of taking a different angle at the independent commercial lab world. And there are some new partnerships, but I also see health systems and their lab leaders, and frankly, not just the labs, the chief executive officer and team saying, we want to leverage this in a way that's more impactful, that drives a bigger bottom line, that creates better outcomes for patients. And we need a good way to do that. But maybe they aren't ready to sell it. Maybe they want to go bigger, but they're not ready to sell fully. Just curious to hear from both of you guys on where does this thing go? And is there some like crystal ball you have that could be instructive to all the healthcare Boombostic Health fans that are out there on the show right now?
Bradley, yeah, being a Tennessee fan, I love to speculate, right? Like, just wait till next year, right? And I very much believe, from a concept standpoint, history will repeat itself. Now, it could be in somewhat of a different form, but lab is mission critical. It has always been. You talked about earlier how much of the medical record, 75, 80% of the medical record. My dad, thankfully, successful last week, was released from the hospital. He didn't get out of the hospital until he got his lab result. So, certainly
Well, that's good to hear. I'm glad he's doing better.
certainly personally, right? From that perspective, um, some of the things that I think will happen and just be very, very high level. You continue to see physician employment increasing. Approximately 55% of physicians are employed by their corresponding health system. And so I think there's very much a drive to make lab strategic. It's in the eyes of the executives, to your point. Uh, in some respects, LabCorp and Quest can help drive that momentum because they have a very aggressive position, and they state it publicly, that they want to increase their affiliations, their partnerships with hospitals. Now, that doesn't necessarily always mean acquiring the outreach asset, but to your point, what it does is it makes that chief executive officer, chief operating officer, and so on look at the lab and ask themselves, are we maximizing the strategic value of our laboratory? That could be on the outpatient side. And what you see today on that, we call it inReach, in that employed physician group, a lot of hospitals, they are providing those services to that employed physician. They just don't do it under a structure that we might define as outreach. So it continues to be very visible, in my opinion, and more executives are starting to look at that asset and think in terms of what you termed earlier, a forward-looking strategy. What should we do with our strategic asset?
So in
Consolidation's
term,
always in
right.
play. Yes, sir. Yep.
Yeah. So in terms of the what should we do with the strategic asset, my takeaway is there's increasing volume happening within the health system, and it's the in-reach concept is it's the health system marketing to its own employed physicians the fact that their lab is able to perform the services that they need, and then that lab is acting as like the switch or the quarterback deciding where you would do the reference testing instead of having that happen at the individual physician level. Is that fair? Yeah.
Absolutely.
Right.
And
Matt,
nothing
yeah,
drives economies of scale like lab. Sorry, Matt.
right. So Matt, yeah, Matt, why don't you comment a bit on this? You've been with some high flyer labs as well and learned through some of the ups and downs of that, more on the side of just how the models evolve and reimbursement evolves and so on. But what do you think about where the health system is going to be able to really make a big play, or where the reference labs are making a play, or even future forward, like where is it going to be 10 years from now? Like, do we end up with one gigantic monolith that's doing everything, or is there a whole bunch of different specialization, or is it some combination? Do you think people start partnering more as well in these arrangements that are strategic, that are non-traditional, like where we see that we're enabling research networks between healthcare systems and labs, and having those connect out to even life sciences companies? Like, what's your crystal ball say?
It doesn't go 10 years out. I can tell you now. As far as I go is maybe 24 months. But a new player has entered the market. A new competitor has entered the market in the past 5 years, and that's the growth of the physician-owned group practice. So the hospitals are now in honestly direct competition with large group practices, especially here in the Northeast. Here in the Northeast, we have many that are 200 physician plus. Now, they started with their own endoscopy suite, right? That's where the entry point really was. Then they went to surgical centers, and they're taking all of this revenue that the hospital had previously and moving it offshore to them. Now we're seeing it in the hospital lab. So before, you would go get your labs before your physical filled at like a Quest LabCorp or your hospital lab. Now these large group practices have opened up their own lab. So now you're seeing the advent of just another competitor into the market. Now, bad for reference labs, right? But now, to Jeff's point, hospitals are going to have to promote their lab even more stronger to their physicians who are part of their hospital network.
So let me add another layer to that. When I think about why do we have healthcare? Theoretically, we have healthcare to help people live happy, healthy lives that are as long as they possibly can be. And so in reality, it's all about longevity. And if you look at the various aspects of longevity, you've got everything from more of the functional medicine world, where it's how do you take care of your body with nutrition and different strategies that aren't inside a healthcare system. But then you have the ongoing monitoring of your diagnostic indicators that are coming off of your various biometric sensors. Like I've got my Whoop band, that I constantly pay attention to. How am I doing? They just actually announced a new version of the Whoop band that has a medical edition It's called MG, I think, for medical grade. And it has a special program that I opted in for. I don't know if I'll get into it. If they know that I'm in healthcare, maybe they'll let me in. But it actually has an ongoing laboratory testing component. And so, like, the Whoop band is
And an
connecting to
EKG
the
function.
labs.
And an
I
EKG.
went to, yeah, an EKG function as well. I went to a dinner recently with some of the foremost experts in functional medicine who all are talking about longevity. They're not saying functional medicine. And every single thing they all do starts with, guess what? A lab test. And so we all wear these Whoop bands and we all wear Apple Watches, and everybody's starting to pay attention to these metrics. But absent the lab insight, those metrics are not complete. They're going to leave huge blind spots. So when I look forward, I don't know if it's 3 years, 5 years, 10 years, whatever, there's actually a whole new paradigm where gone are the days of only running a test on a one-off basis because you've got some acute issue, or on the other end of the spectrum, running these kind of general panels, and where we'll have much more precise, specialized testing happening way before you get sick. Like I do testing on an ongoing basis to look at my microbiome and to look at other factors that I believe deeply have a connection to cognitive function, have a connection to mental health, have a connection to your likelihood of developing certain diseases, including cancer. And so to me, it's this all the talk about the mechanics of where does the lab testing get done. I think what's ultimately going to be the mega trend that determines that is going to be how lab actually starts to get integrated in a more proactive, preventative way, and then carries along throughout that health journey to deal with it if you're in some type of a critical issue or something that's chronic. Or but it's not just it's just fascinating, really, if you think about it. So the metaphor I've been using, if you zoom out, is, are you familiar with the artist Seurat? The artist Seurat is the most well-known. I think they call it pointillist, but it's the kind of art where if you zoom in, it's all these little tiny dots, and you don't see anything. But if you zoom out, it's this amazing, brilliant piece of art. And that to me is what these signals are that you can glean from lab. It's when you zoom out and you see all this information in an ongoing way, the power to prevent and predict and prevent is massive. And I'll bring it home in one specific point. You've got people who develop Alzheimer's, which means that they've been actually diagnosed with Alzheimer's. I was talking to a friend today who's a senior leader running the Alzheimer's program for one of the most well-known major pharma companies. And he was talking about the view they have is the indicators that you're going to be likely to develop Alzheimer's show up 20 years or more before you actually have an Alzheimer's diagnosis. The indicators exist in lab to start identifying that, not by saying here's a specific Alzheimer's test, right, but by saying, based on all this historical regression analysis of all these different patients and their lab values that ended up developing Alzheimer's way down the road, what are those constellations that generate the signal that says this is somebody who, by proactively managing their care, by proactively managing the things they do, they may never have an Alzheimer's diagnosis because you're managing this as a chronic disease, similar to how diabetes used to be a death sentence, right? People did not have, people were getting amputated limbs and it was brutal. And now we have these amazing technologies that monitor that and care for that as a chronic disease. So in summary, while the opportunity exists within this health system lab space to innovate and drive value, and it exists in independent commercial labs to integrate and drive value, to drive more of the consolidation, economies of scale, those kinds of things. The really big opportunity, the really big play is to start actually using this information in an integrated manner that's predictive, that's preventative. Steve Jobs had this famous quote where he said, the computer, they were introducing a new Mac, and he said the computer is one of the is the most the most profound creation by humankind because it's like a bicycle for the mind. And if you think about what AI is like a Ferrari for unlimited, minds, right? Whatever the metaphor is you choose, but it's going to make you go way faster and have way more horsepower than ever. Where should we apply that?
Yeah.
Healthcare is where we should apply that. So,
Yeah.
with that, I'd love to kind of wrap this up with just a couple of closing comments from you guys. Like, hey, I'm a healthcare leader. I'm an entrepreneur. I'm a health system executive. I'm somebody who cares about my own health. What do you think people should be doing to be more strategic? And I'll start with Matt, and then kind of round it out with Jeff, and then I'll close out. Go ahead,
Yeah.
Matt.
Thank you, Bradley. I love that statement. So I think it's a challenge to our the healthcare institution, right? So we have all this data now, this mosaic, honestly, of data, and whether it's from your personal device like your Whoop, your Aura, your Apple Watch, the diagnostic data that you get from a genetic test that you choose to do, and then also all of this lab work done that has been like infancy till now. How, as an industry, do we put this all together and paint a picture of success in treatment for patients moving forward? Like, that's the challenge that's in front of us.
Awesome, Jeff. What do you think, my friend?
Yeah, Bradley, Matt, just really appreciate the opportunity, the comments. Bradley, your comment about preventive and working in the confines of value-based care, we're still way too historical based and treating the disease and not the problem. I think over the next 10 years, I think the market's going to force us, along with all the other tools, to begin to think of it more in terms of preventive measures. Uh, and the other piece is lab is such an innovative, creative discipline. I think it's always going to be here. And it's just how do we do it better? Just really excited to be in this space and looking forward to the next 10 years.
Yeah, well, thank you so much. And I think this has just been a fantastic conversation. Really appreciate you guys being on here and all the good work that you're doing to really bring a much more proactive, better approach to healthcare that helps people diagnose things quicker, helps them prevent issues, helps them get better faster, and ultimately helps them get into research if that's required. And then beyond that, I think we'll make this leap forward. And ideally, we avoid the HAL 9000 where Hal goes haywire and starts trying to use, lab for evil. But in all seriousness, there's also a mechanism to ensure that that doesn't happen through reinforcement learning with human feedback, which is a whole other, podcast episode. But there are lots of ways that technology is converging with expertise and information to bring the best possible model to preventing illness and disease. And I think over the next 10 years, for sure, we're going to see such massive advancements in how laboratory insight is applied that we will look back to this moment and say, can you believe how we used to do it? So with that, thanks so much for being here for another episode of Boombostic Health. Have a boombastic day, and we'll see you next week.
Thank you.
Thanks, everyone.